Hi, everyone. I'm just coming at you today. I have a rant that I think everybody should hear. So I'm just putting it out there and encouraging people to get involved where you can. I, Everybody who knows me, who's followed me on Facebook and YouTube, know that I have a situation in my life that I have to deal with on an everyday basis. If you don't know, I will just give it up in a couple of seconds here. Anoxic brain injury, cerebral infarct, and long-term brain injury. So there. So that's basically what's happened to me if you didn't know that. I'm talking today about the importance of health insurance in our society, but more specifically in my life. When I initially had my brain injury, I wound up spending 10 days in the hospital in Fond du Lac, which is where I had my initial injury was there. And they, at the end of 10 days, had sent me a bill. I did have health insurance through my employer at that time. And the bill was just for about over $56,000. And with my insurance that I had through my employer, I only had to pay, I think it was like $60 or $20. I can't remember what it was. It was amazing to know that I had insurance. I didn't have to worry about that crazy bill with what I had experienced and with the way my life was going to change. I had employer sponsored health insurance for a little while, and then it ended because I was no longer employed with that bureau. So I wound up not having any health insurance at all. And this happened about 2.5 months into my brain injury rehab. So I didn't have any coverage at all. I had gone through the process of applying for Badger Care, which is the state Medicaid service, for those of you who don't know that. And then I also had applied for Food Share, which is a fancy term for food stamps for myself because I had no income to purchase food, which is obviously what food stamps are for. I wound up getting Badger Care, which paid for my brain injury rehab, but also it paid for my medications and for my physician visits. And then when I was receiving the food stamp benefit, I was using that to supply the household where I'm living. I would buy the groceries for the household, and that was like my rent because I had no income. Recently, the state government had gone through the process of reevaluating people's income requirements for Badger Care and for Food Share. I was got a letter that said that I was making too much money to remain on the Badger Care, even though my income is like near nothing. I was I was making too much money, so I was being taken off Badger Care, but also off Food Share. So I was no longer making it, and it was no longer getting any government benefits at all, which is horrible because I am disabled and I will be needing care for the rest of my life, and I need that support, but I didn't. So when I called, they said, "Well, you no longer are eligible, but you can apply using the health insurance marketplace, aka Obamacare, aka bullshit." What happened was because of the shift in healthcare funding related to the federal guidelines, a lot of people are being taken off of the public assistance that they need and are being shifted towards the marketplace. So I, being the good citizen that I am, went to find out about the marketplace, and I went online and I entered all my information. And initially, they had said that they were giving tax breaks to people that lived under the federal poverty level, but also that they were giving tax breaks to people as well who met requirements. I went through the process and I applied. I also called the federal government agency who deals with health insurance marketplace, aka Obamacare, aka bullshit, and I was told that I didn't qualify for any kind of supplement or any kind of subsidy. So fine, whatever. So then I'd heard that people were getting this health insurance really cheap, like $30 a month, $40 a month, whatever. And that's not the case. For some people, I'm sure it is. For me, it's not. I did go through all the Obamacare plans. I went through, the what's available on the marketplace, and I went what's unavailable on local providers like Molina and Anthem and Arise, just crazy insurance companies that are popping up out of nowhere to provide crap insurance. The best insurance plan that I can get is $230 a month. That's with a $5,000 deductible and with no prescription benefit coverage. Well, the prescription benefit coverage is very important for me because one of the medications that I take as a result of my brain injury costs about $300 a month. That's for one medication. Unfortunately, I take 5 other medications. So 6 medications total, with one of them being $300 a month, and another one of them is not available in a generic. It's still in its brand name phase. So the pharmaceutical companies is putting out there however much they want to put it out there for. That's a problem. And anybody who knows my situation from this past summer, I did get mugged waiting for a bus one summer evening, and that required me to go to the ambulance ride to the emergency room. I had a CT of my head because I had a concussion on top of my brain injury. Then I needed to have a CT of my shoulder and 5 x-rays taken of my shoulder, my arm, and my chest because of the injuries that I sustained. I also needed to go back to the doctor the next day, and then a week later I had to go back to another doctor. All of those things together cost me a little over $8,200. $8,200 is only $3,200 more than an out-of-pocket deductible for the crappy insurance that I have to pay. I want to reiterate that I don't have the money to pay for this insurance, but if I don't sign up for something by December 15th, I will be in violation of the Affordable Care Act law, which is ridiculous to me. I can't imagine that they actually expect people to do this. That is my rant about Affordable Care Act, how it works in my life right now, which it doesn't work in my life right now, but I don't really have a choice in how it's going to pan out for me. I also want to encourage everybody out there, please check in with people that you know that have physical, psychological, mental disabilities, but also people who are unemployed, who are self-employed. Make sure that they, and even people who are employed, make sure that they know that this is a law out there. You have to have shitty insurance provided by crappy insurance companies, provided by or subsidized by the government that will provide you with crap coverage. That is the law. They will penalize you if you do not comply with the law. It's like, this is the most ridiculous thing ever, especially for people who are law-abiding citizens. I've been working since I was 15, and I've paid taxes since, and I've paid a lot of taxes in the last couple of years as a result of my career. I deserve to have health insurance because of my disability, and I don't get it, and it's not fair. And anybody who is aware of this happening, please be aware that it could be happening to you. Please talk to the people around you and make sure that they are going to be they're going to be covered by healthcare. So everybody, take care, and Have a good day.